Dr. Gottlieb, you've seen the report and you've heard about the suggestions, perhaps, that people wear masks now. What is your recommendation this evening?
Well, look, it's not a substitute for social distancing, as was said in the segment, and you don't need to wear a medical mask. But there is data showing that if you wear a mask and you're contagious, you either are symptomatic or an asymptomatic carrier. And we know a lot of people are either mildly symptomatic or asymptomatic and still can spread this virus. It reduces your risk of transmitting that virus by as much as 50%. And that's a lot of risk reduction in terms of the ability of someone to transmit this virus for a simple intervention. And that's the real value of the mask. It's not necessarily to protect someone from getting the virus. It's to protect them from transmitting it. If they go out and they think they're asymptomatic and they think they're fine and they happen to be an asymptomatic carrier of the virus or spreader of the virus. So there is value on a population basis if everyone was wearing masks. Now, again, you don't need to wear a medical mask. A bandana or some kind of cotton mask, properly fitted, properly constructed, can be helpful as well. The challenge with the medical masks right now is even when you look at like a level 1 procedure mask, something you might find in a dentist's office, which wouldn't be used in a healthcare setting, in the hospital setting by and large, the starting material for that mask is the same starting material that goes into the N95 masks that doctors and nurses need. And so pulling even procedure masks out of the medical system right now would cut into the supply that's needed for healthcare workers, and so we wouldn't want to do that. And that's been the hesitation around a broad recommendation. That and a perception that if you tell people they can wear masks, it's going to encourage people to go out more, when really what they should be doing is staying home.
Jane?
Yeah, I had a question. I think a lot of people think, doctor, that people were being told not to wear masks so that they wouldn't go out and buy the mask, and that actually everybody should be wearing a mask. What do you say to those who think, I don't believe it when they say I shouldn't have been wearing a mask, they just did it so I wouldn't go get one?
Well, look, I think we made a mistake in this country shaming the use of masks, quite frankly. And a lot of people probably have medical masks right now that they're reluctant to wear out in public. And if they have it, perhaps they should wear it, especially if they're in an area where it's epidemic, where the spread's epidemic. It can provide incremental protection. Where the mask becomes disadvantageous is if you're putting it on improperly and you're going to be touching your face to adjust it a lot, so it's going to make you touch your face more. That would be unfortunate. That could actually spread the infection, because we know that a lot of the spread of this infection is from people touching contaminated surfaces and then touching their face. But the masks can be incrementally helpful in protecting you, but more importantly, where they come in really valuable is they prevent people from spreading the infection to others. And we've seen this in studies with influenza. And so the recommendations right now for flu, if you have the flu and you go out and you're symptomatic with the flu and you have to go out, you have to go to the doctor or do something, the recommendation is from the World Health Organization is to wear a mask. So clearly there's a recognition that masks can help in the setting of an epidemic and cutting down the rate of transmission. So it wouldn't be any different in this setting.
Jane, thank you very much. Jane Wells with us tonight. Doctor, before I let you go, new numbers just out from the city of New York. Now more than 1,000 people have died in New York City. That's up by 182 in the last 24 hours. 20% of all cases now going to the hospital. Your reaction tonight?
Well, look, they're still in the throes of an epidemic right now, and those case numbers are up a little bit over recent days. Those are high in terms of the number of deaths, so it's not really coming down right now. The numbers on hospitalizations and the numbers on deaths are going to tragically lag the epidemic in New York City. Time to hospitalizations more than a week, so infections that happened a week ago are now being hospitalized. And time to death with coronavirus in some of the studies we looked at is anywhere from 3 to 6 weeks. So people get hospitalized a week after they get infected, and then they have prolonged hospitalizations before they succumb to this illness. So those tragic numbers are going to lag the actual epidemic peak in terms of new infections in the city.